Assalamu alaikum. I am Dr. Pervin Akter, Professor and Head, Department of Physiology, Bashundhara Ad-din Medical College. Today I am going to deliver my lecture on Introduction of Respiratory Physiology. Respiration. Respiration is a process by which oxygen is transported from atmosphere to the cell and carbon dioxide is removed from cell to atmosphere. And type of respiration. Respiration is two types: external respiration and internal respiration. External respiration. External respiration is transport of oxygen from atmosphere to the cell for oxidation of ingested food materials and removal of carbon dioxide from cell to the atmosphere. And internal respiration is also called the biological oxidation. It is called by utilization of oxygen and production of carbon dioxide by the cell and gaseous exchange between the cell and the interstitial fluid. And major events of external respiration. There are four major events of external respiration are: number one is the pulmonary ventilation. It means the inflow and outflow of air between the atmosphere and the lung. Number two is the diffusion of oxygen and carbon dioxide between the lung and blood. Number three, transport of oxygen and carbon dioxide in the blood to and from the cell. And number four is the regulation of respiration. And phases of respiration. Respiration has two phases: inspiration and expiration. Inspiration means breathe in of air into the lung from the atmosphere and duration is 2 seconds. And expiration. Expiration means breathe out of air from the lungs to the atmosphere and duration is 3 seconds. And duration of inspiration is less because it is an active process and it needs muscle involvement. Respiratory rate. Respiratory rate is 12 to 15 breaths per minute and about 500 ml of air is inspired and expired which is normal breath and it is called the tidal volume. Oxygen enters the body is 250 ml per minute and carbon dioxide excretes out of the body is 200 ml per minute. So, the calculation of the pulmonary ventilation is tidal volume into the respiratory rate. So, the pulmonary ventilation is 6 liters per minute. Now, the physiological anatomy of the lung. Two lungs are housed into the chest cavity and are separated by mediastinum in the center. And it consists of respiratory airways, elastic connective tissue which are capable of being expanded and collapsed and has extensive network of interconnecting blood vessels. And respiratory function of the lung is to exchange of gases. And respiratory passes, it divides into 23 times between the trachea and the alveolar sac. And first 16 generation of passes from the conducting zone that transport air from and to the exterior. And conducting zone is made up of bronchi, bronchioles and the terminal bronchiole. And function of conducting zone is to filter, warm, moisten air and conduct air into the lungs. And last 7 generation of the passes from the gas exchange area where gaseous exchange takes place and made up of respiratory bronchioles, alveolar duct and the alveolar sac. What is the respiratory function of the nose? Respiratory function of the nose are air conditioning function, filtration, warming of inspired air and the humidification. And non-respiratory function of the nose are filtration function, immunofunction, metabolic function, phonation and the acid-base balance. Now, the pressure changes during respiration. There are 3 pressure changes in the respiration. There are intrapleural pressure change, interalveolar pressure change and the transpulmonary pressure change. And what is the intrapleural pressure change? It is the pressure of fluid in the thin space between the lung pleura and the chest wall pleura, and intrapleural pressure is always negative due to continuous suction of fluid by the lymphatics. This figure shows the pressure changes during the different events of the respiration. And now the intrapleural pressure change. At the beginning of the respiration, intrapleural pressure is minus 5 centimeter of water, and at the end of the respiration it is become more negative, that is the minus 7.5 centimeter of water, and during expiration it become again the minus 5 centimeter of water, and it is always related to the atmospheric pressure, which is about 0 centimeter of water. Interalveolar pressure, it is the pressure of air inside the alveoli. It is equal to the atmospheric pressure 0 centimeter of water in between the breath. During inspiration it falls below the atmospheric pressure, that is minus 1 centimeter of water, and during expiration it is rises above the atmospheric pressure, that is about plus 1 centimeter of water. And transpulmonary pressure, it is the difference between the interpleural pressure and the interalveolar pressure. And what is the collapsing tendency of the lung? Collapsing tendency of the lung means that the lung tends to collapse during expiration because of elastic forces of the lung tissue and surface tension of the fluid that lands inside the wall of the lung of the alveoli. Now the surfactant. Surfactant is a surface active agent in water that reduces the surface tension of the water. It is secreted by special surfactant reduced secreting cell of the alveoli, that is type 2 alveolar pneumocyte. It is chemically a mixture of phospholipid, protein and iron, and premature newborn babies do not have the sufficient surfactant, so they have the hyaline membrane disease. What is the importance of surfactant? It decreases the surface tension of the fluid lining the alveoli, thus prevent the collapse of the lungs and helps in expansion of the lungs in a newborn baby. And it also stabilizes the size of the alveoli, and it prevents the accumulation of the edema fluid in the alveoli. Now the respiratory muscle. Respiration is mainly composed of the inspiration and expiration. So the muscles of inspiration is a active process. So in quiet inspiration the muscles is the diaphragm, and forceful inspiration muscles are external intercostal, sternocleidomastoid muscle, anterior scalene and the latissimus dorsi. And muscles of expiration, quiet expiration is a passive process, so it does not require any muscle, it occurs due to the elastic recoil tendency of the lung. And heavy expiration is an active process, so it needs the muscular activity, and muscles are internal intercostal and rectus abdominis. And what is the mechanics of the pulmonary ventilation? The lungs can be expanded and contracted in the two ways. First, the downward and upward movement of the diaphragm to lengthen or shorten the chest cavity, and by elevation and depression of the ribs to increase and decrease the anterior posterior diameter of the chest cavity. Now, what is the mechanism of inspiration? In quiet expiration, the contraction of the diaphragm pulls the lower surface of the lung downward, so the vertical diameter of the chest cavity increase. And in forceful inspiration, contraction of the external intercostal muscle raises the rib cage upwards and forwards. So anterior posterior and transverse diameter increase. So the chest cavity expands, interpleural pressure falls, means the pressure becomes more negative, from minus 5 to minus 7.5 centimeter of water. Lungs stretch and inflate, interalveolar pressure falls below the atmospheric pressure, about 500 ml of water inflows into the lung. And mechanics of expiration. In quiet expiration, diaphragm relax, chest wall and abdominal structure compress the lung, so the vertical diameter of the chest cavity decrease. And in heavy expiration, contraction of the internal intercostal muscle pull ribs cage downwards and backwards, anterior posterior and transverse diameter decrease. So the chest cage decrease, interpleural pressure rises, lung compress and deflate, interalveolar pressure rises above the atmospheric pressure. So about 500 ml of air outflows from the lungs to the atmosphere. So, this is all about my lecture on the introduction of the respiratory physiology, first part. So, Allah Hafiz. Assalamu alaikum.